Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to our series exploring the unique challenges, misconceptions, and lack of awareness surrounding ADHD in females. In our previous episode, we examined how ADHD often presents differently in females versus males, the specific barriers to accurate diagnoses females encounter, and the way societal expectations can mask symptoms. Dr. Erica Ramey is continuing this important conversation with me by discussing effective interventions and resources tailored specifically for females with ADHD. You'll also hear recommendations on therapy, support structures, and coping strategies that can create better outcomes in terms of managing symptoms. Erica, thank you for continuing this discussion with me.
Yes, I'm excited to. Love this topic.
So I want to start out with the environment, such as the school setting, a home, work. How does that environment impact the success of females with ADHD?
That is a really great question, and it brings up a good point that a good, well-structured environment can make the difference in whether someone is successful with ADHD or not, and whether they maybe need medication or not. So I love that you brought that up. There are a few things that I've noticed about our school systems that maybe are working against our young girls with ADHD. One, we start preschool, kindergarten at a very early age. So we start at age 5. And there was a big study done in the past few years that showed that the younger a child was when they started kindergarten, the more likely they were to receive an ADHD diagnosis. So what I want to point out is that doesn't mean that more children had ADHD. It just meant they were more likely to get a diagnosis because their symptoms were disruptive. But if we think about it, they're just younger. They're younger. They don't know how to sit still for as long, as sustain attention for as long. And in our traditional school system here, we do have high expectations for how long a child should be able to sit in their seat or sit on a square.
Are they high expectations, or are they really, honestly, unrealistic expectations for their age?
Unrealistic would be a better way to describe that, right? So a newly 5-year-old child who has spent the past several years playing and socializing and learning through play may not understand or even tolerate, well, now you need to sit in this small desk or in this colorful square on the carpet for 6, 7, 8 hours a day. And there are other ways to do this, right? We see education handled very differently in other countries that, frankly, outperform us in educational attainment and achievement, where the focus is different. There's more play, there's shorter class days, and we have more tolerance for neurodivergence. So the environment can really kind of make it or break it for a child. So breaks and recess and arts and tolerance for taking a little bit longer to transition from one task to another can make a big difference in success for young girls with ADHD, and also for their mood. So if this child's in the classroom and is constantly seeing C's and low performance, and then getting in trouble at home for their grades, and then getting the impression I must not be very smart, or I'm not a good student, or school's not for me, then we see, again, some of those other mental health concerns that can develop from that. So a supportive environment that allows for some flexibility can really make a difference in their success in school, but also their mental health later on.
Absolutely. So what are some specific interventions, therapies, and resources particularly effective for females with ADHD?
Right. So the more we can do to decrease the mental burden or the mental tax on women and young girls with ADHD, the better. And what that's going to look like could be as simple as a key bowl by the front door where your keys go. So we're, we don't lose our key, or we're not looking for it, the night before.
Yes.
Backpack organization for kiddos. So here's where your backpack goes. Here's where the folder with the homework goes. So, and we have a routine in place. We come home from school, we sit in this seat, we have our snack, we play for a little bit, we do our homework, it goes back in the folder, and the folder goes back in the backpack. And this sounds silly. This sounds so simplistic, but having a routine takes care of some of the trying to remember, where did I put my backpack? Where is my homework? Did I do my homework? So if we have a routine, it just takes out some of the guesswork because, yeah, I know I did my homework. It's in the folder's in the backpack is by the back door. So routine, structure, a place where things go that's consistent. That helps all of us, but especially someone with ADHD who may struggle losing things or being organized. There's, of course, tools depending on, if you're in the workplace, there's tools within our calendar systems, organizational tools that can help us pin tasks and stay scheduled. Reminders can be helpful on our phone. We just have to, I would encourage you to kind of pick what works for you and maybe pick one that works for you. Otherwise, we can become overwhelmed by just the reminders and the tasks and the emails, and we start to ignore them because we get so many of them. So
kind of like alarm fatigue.
Exactly.
Like
That's exactly what I was thinking. For like nurses and healthcare workers who hear the beeping all the time, eventually you hear nothing. So it needs to not be one more overwhelming thing, but rather one thing that helps you kind of stay organized and on top of things there. I do
Some of the things that you're listing, and I know this sounds so minute, but I hear a lot of parents who will complain because their child, who is ADHD, has been diagnosed ADHD, forgets to turn the light off in their bedroom. Or in the hallway. Like that's a constant battle they fight. And so as I've just been kind of listening to you and listening to some of the interventions and ideas, my thought went, is that really a battle that is necessary to fight? Or would it be just something like, I'm just going to get one of those light switch thingies that senses when you're in the room and then just shuts off when you're not in the room,
Right. I like that. So pick your battles, right?
Yeah.
So at the end of the day, what's more important? That they turned off their light or that they did their homework? Or they turned off their light? Is it worth a meltdown, right? Or is it worth disrupting what they are trying to focus on to say, go back and go turn off your light and then, do X, Y, Z. And it's not just lights, right? Did you close the door? So that's a bigger deal when it's an external door. Like, did you close the front door? That matters, right? That's a safety thing. But if it's not affecting their safety or someone else's safety, not everything is worth making a battle out of it. We do want to pick our battles.
Right.
Or make it a routine again.
Yeah.
Can we brush our teeth, we turn off the light kind of thing.
You want to teach them, purposefully how to be responsible so that when they go to college or when they move out. So with someone with ADHD, when you're talking about interventions, my brain immediately went to, do I teach them and get on to them for not doing something? Or do I teach them how to remember how to do something, how to manage their time, how to make a schedule, how to...
Right. It's going to be a lot more beneficial to teach them the tools for managing those things than to just teach them what has to be done in your house.
Right.
So, by the time they're in their own home, they may just use an app that turns off their lights. Let's be honest, right? There's switches for that. Alexa can turn off the light and lock the front door if we need her to. They make things to help us with that. So what you're really teaching your child is, a light being off is really important to me. It's so important that I'm going to ruin both our days and start a fight over turning off the light. But that doesn't necessarily teach them when you're in your own home, you need to turn off the light. So giving systems and tools is going to be more helpful as they transition into adulthood than just being really rigid about things that aren't going to make sense to most children.
Right. Therapies and resources. Besides interventions.
Absolutely. So the therapy of choice, sort of the gold standard, is CBT, is cognitive behavioral therapy. And that is available through, most licensed therapists and clinical psychologists. And with CBT, it can focus on some of the things that you need as far as organization and tasks, but it can also help prevent some of the other things we've talked about, secondary depression or anxiety. Or if you have both, right, you could certainly have ADHD and anxiety. And
Mm-hmm.
CBT can kind of help make sure that we're addressing both, because both can cause that inattentiveness there. So CBT would be kind of your gold standard there. There are different kind of therapeutic modalities coming out these days. There's a video game for children with ADHD that's kind of interesting. I've tested it out a little bit. It's interesting. It's new. It's kind of a novel therapy that we're looking at. A lot of the focus with ADHD that's not medication is going to be on behavioral modifications. So some of the things we've talked about to help reduce mental workload and help reduce distractions and keep you organized. So there's a lot of emphasis on what you can change about your environment or your day-to-day activities to help you be more successful.
That's interesting. A video game.
It is interesting. Yes. Yeah.
I will say with cognitive behavioral therapy, I have found that it is actually hard to get in to see a therapist in a lot of different states and areas. So, yeah. I mean, if this is something you're looking at, do get on the list.
Mm-hmm. That's great advice. And I like to tell people, even if you don't need it today, go ahead and get on somebody's list, because 3 months from now, that appointment may be open, and, get established so that when you need it, you have access. Absolutely. We definitely have a shortage of all mental health providers.
Yes. What are some long-term consequences of undiagnosed or untreated ADHD in females, particularly like mental health, their work and academic performance, and even comorbidities like depression, anxiety?
Absolutely. Absolutely. So we hinted towards some of that. If a young female in the classroom is struggling, but maybe not disruptive enough to get treatment or a diagnosis, then it starts to become more about how they view themselves as not being very smart. If the child has a lot of impulsivity and hyperactivity, it can also hinder their ability to make friends. So other children may not want to be friends with somebody who's getting in trouble a lot, or whose hands are, always kind of accidentally hitting them or knocking them, or someone who maybe they don't view as smart as them because their grades aren't as good. So it can cause issues with developing friendships. It can cause issues with self-esteem. And then that's when we start to see more depression as a result of that. In the teen years, we start to see more substance use for individuals with ADHD. And there's a lot of theories about why that is. For some theories are, well, if you're more impulsive or hyper in general, maybe you're more drawn to that. There's also self-medicating theories, like maybe trying to slow the brain down a little bit or slow the body down a little bit. But regardless, we do see more risky substance use, and then just more risky behavior in general for those with untreated ADHD. And then, as you kind of mentioned, and we sort of talked about, if you have severe ADHD symptoms and you're lucky enough to even secure a job, you're going to be at risk for losing that job when things fall through the cracks or things get missed, or thinking about healthcare, if mistakes get made, right, or patients get harmed, or the wrong medication gets administered. It can cause really significant issues and make it difficult to keep a job. So the consequences really can be, as mild as you just forgot to do something small, all the way to loss of relationships, loss of jobs, and then significant other mental health problems.
So raising awareness, I mean, we're seeing it more of a discussion of females with ADHD in social media. But, like we were talking about earlier in our first episode, a lot of those stories are really just describing a plate that is just so full that you can't keep up with everything. So yes, awareness is coming up, but is it really rising in the healthcare realm? Is it really rising with those that treat ADHD? Is there more research going on? How can we raise more awareness for the differences between males and females with ADHD?
Right. So podcasts like this, right, where we kind of shed some light on this experience. And as providers, it is remembering that it's not just the squeaky wheel that has ADHD, right? It's the maybe underperforming but intelligent young lady or girl in the classroom that maybe not rising to the level of attention. So we want to, and that's on us, of course, that's on providers to be looking, and sometimes it starts with they're coming into my clinic because of behavioral issues, but the behavioral issues came after being made fun of for not being able to stay in their seat or getting in trouble a lot. So part of that's on us as providers to pay attention and to look for that. But then whether it's ADHD or other things like we've talked about, I still want to encourage people to go see a provider if they're concerned about any symptoms that they have. So maybe it's ADHD, maybe it's not. But if you're having significant symptoms and it's impairing your functioning and starting to cause problems in your mood, it's worth an evaluation. It's worth saying, okay, here's what's going on. Is it depression? Is it anxiety? Is it ADHD? If it's severely impairing you, it's worth taking the time to kind of walk that out a little bit and see what's going on there. So still access treatment, still, whatever's available in your area, it's still worth seeking that out.
So I know we're talking about females and kind of the differences between males and females, but I wanted to ask while you were talking about screening, and going to see a provider, can a male also have those same types of symptoms as a female where maybe they fly under the radar like the female does?
Yeah, absolutely. So as we kind of mentioned at the top of the last podcast, we have the 3 different types. You can be inattentive, you can be hyperactive primarily, or you can have both pretty equally. And while the hyperactive is more common in men, anybody can have both or one or the other. So there can be men who are inattentive and we see, something similar, sort of underperforming or seeming to be lazy or we see it more as their personality than as a mental health issue. Absolutely. Yes.
What tools do we use to screen for ADHD?
Great question. So there are simple screening tools, questionnaire type things. Like the Vanderbilt is one of the more commonly used one. And those are just looking for the diagnostic criteria, the symptoms of inattentiveness, the symptoms of hyperactivity. So we use those. But there's also testing, where you're sitting down in front of a computer or device and you're told to perform a task each time you see or hear something. And so it's checking kind of your reaction time. So we do have much more detailed testing along those lines. Usually that's done with a psychologist or certainly an experienced mental health professional. So we have screening tools and then we have different diagnostic tests that can be used.
And then as far as the treatments, how do you determine the best way to go when you decide that this person does have ADHD?
Right. So we're looking at impairment at that point as well. So as we've mentioned, CBT or cognitive behavioral therapy is kind of gold standard. But most individuals, when they seek treatment, what they're looking for at that point in time is a medication option.
Right.
And so so typically that'll be kind of the next step. And then we have stimulants, which are what most people are more accustomed to, things like Adderall or Vyvanse, Focalin, things like that. And then we have non-stimulant options, which there are only a few, but there are some non-stimulant options available. So which one you go with is going to depend on the individual. So stimulants can be really great for attention and focus, but for some people, they can be really problematic for mood and anxiety. So sometimes a stimulant is a great choice, and sometimes it's not going to be the best choice for that person.
Gotcha. Family members and, some support networks, how do they really, what role do they play with helping somebody cope with ADHD?
Well, oftentimes ADHD is inherited. So some of the role, let's think about that. So some of it is role modeling. If you've got, if a child has ADHD, there's a good chance one or sometimes both of the parents may have ADHD. So we're role modeling that, right? What does it look like to manage ADHD? So trying to set a good example for these are the symptoms that are experienced and this is how I manage them, and for the adult in that case. So if you have it yourself, setting a good example for managing it, admitting how frustrating it can be, but how you're dealing with that. Watching for your own negative self-talk so that your children don't talk down to themselves when they make mistakes.
Right.
So I would
That's
start
a good
with that.
one.
I would start with that. So being an example there, and then trying to create space for the difference in how an individual with ADHD might function without just making excuses. So there's a difference between letting a child, quote, get away with things, and then recognizing that their brain works differently from their sibling. So expectations may need to be adjusted. Again, we're not enabling or allowing a child to kind of not do their best effort. We're just recognizing their best effort might look a little bit different than another child who doesn't have ADHD. So we're making space for how their brain might work differently. And that may mean they have more time to transition between activities. It may mean they need more structure. And it certainly means they need an earlier bedtime. So we're kind of thinking about what we need to do to help each child be successful, and understanding it looks a little bit different if they do have ADHD.
So we love success stories. Do you have any success stories that you can share about how ADHD was diagnosed in a female and they were able to overcome it?
Oh, there's tons of success stories, right? So
yes.
one of the things I like to do is catch it early. So I would say in children and in adolescent girls especially, being able to help them see, okay, well, it's not just you. There's nothing wrong with you, but your brain does work a little bit differently. And then giving them access to treatment and then seeing them be successful is what's been very rewarding. So seeing maybe, I know grades is a terrible kind of marker for success, but it is something we use. So seeing grades improve, but then also seeing her be able to kind of keep those friendships, maybe reconnect with that old best friend that had grown apart, maybe because of some behavioral issues related to ADHD. So seeing the friendships reconnect, and then realizing she doesn't hate school. She was just frustrated that year. So that's probably the most rewarding. In adult women, it usually comes out, I'll see more of an improvement in that negative self-talk. So less feeling like she's a failure, or she's not a good enough mom, or yes, exactly.
Yes.
Not a good spouse, not a good mom. I will say for most adult women, one of the first steps in treatment is making sure they're getting enough sleep. So even if we're using medication and we're trying to improve symptoms from that direction, which can be incredibly helpful, I need to make sure she's also has a realistic time period where she can get some sleep and let her brain rest, and then make sure she's getting enough to eat and getting enough to drink. It's the basic things, but they really make a difference in our ability to focus and pay attention. And then we've added in the things we've talked about for time management and organization. And then maybe we've added in some medication to be helpful. But
steps.
It's steps. Sometimes. So if the ADHD symptoms are very severe, probably going to start with a medication option. If it's more moderate, maybe we try these other things first, and you may or may not need medication to manage your symptoms. So it's individualized. But what I'm looking for after successful treatment is not just that the woman is more organized. I'm looking at, she is feeling like, okay, I can do this. I've still got a lot going on, but I'm not feeling as overwhelmed. I'm not dropping the ball as much. So I'm not feeling as bad about myself as I was before. So I'm really kind of looking for how it's affecting her mental health and her mood outside of the attention and focus piece.
Absolutely. So as we come to the end of our series, what are some of the most important takeaways that you want the listeners to walk away with? What do you want them to remember?
Okay, yes. So I want you to access treatment if you have concerns, just across the board. If you think something might be going on, or you're really struggling in any of these areas, access treatment. You've got nothing to lose except maybe an hour by talking to a mental health provider and just seeing what's going on, right? I also want to encourage everyone to access therapy that feels like they're not coping with life well. Therapy is a great option for that. I want to remind all the women out there who are maybe overwhelmed and overextended that you cannot be perfect all the time. And it doesn't necessarily mean you have ADHD. But if you think you have ADHD and you're experiencing these symptoms we've talked about, make an appointment with your mental health provider. Those would be my big takeaways, I think.
Absolutely. Well, what really stood out to me is support and advocacy, especially for females. When you said, a lot of females will fly under the radar, and you see so many, now they're women, but you see in teenagers, negative self-talk. When you were talking about negative self-talk, you see that so much with females. So support, advocacy, strong networks, family, friends, community groups, and obviously the need to increase advocacy to challenge societal expectations. When we're talking about societal expectations, they most of the time are very unrealistic for females.
Absolutely.
Equitable care experiences. We're seeing some equitable care issues for females with not just, things like ADHD and the diagnoses, but also look at gynecological care.
Right. Absolutely.
Especially pain ignored in gynecological care, symptoms ignored for, heart symptoms. And so it's not just ADHD that we're seeing where females are really not being advocated for, and the differences are not being looked at. So thank you so much for bringing attention to ADHD in females and the differences and highlighting those issues so that we can see hopefully more people get help, reach out in that negative self-talk. I have 3 girls, so it makes me a little teary to think about how, yes. For anyone in healthcare or as a patient whose life intersects with females dealing with ADHD, I really hope that this 2-part series provided a significant awareness building opportunity, and that the key takeaway is that this disorder impacts all genders. It simply may manifest differently based on societal influences and societal expectations that are placed on females when they're children, when they're teens, and when they're adults. So by remaining open-minded, avoiding assumptions, and proactively learning about unique gender-based needs, we can all play a huge role in dismantling barriers and empowering the overlooked ADHD female population to get proper diagnosis, interventions, and the chance to truly thrive. A huge thank you to Dr. Ramey for being an advocate and an educator. Thank you for being here today.
Yes, thank you for having me. It was an honor.
Absolutely. And to our listeners, I encourage you to explore many of the courses that we have available on elitelearning.com to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.